Hello. Welcome to today's episode. In today's episode on Time with the Medics, we'll be talking about the myths of diabetes. We already made two videos on diabetes. We talked about in the first video, we talked about the definition of diabetes, the types of diabetes, the risk factors, and the possible causes. And in the second video, we talked about the management and we focused on the uh, non-pharmacological management. That's the life modifications you need to do as a diabetic. So in this last video on diabetes, we are going to talk about the myths that people hold about diabetes. I'm sure you will find it very interesting, and then you will learn a lot from it. As I was doing my research to make this video, I came across a lot of myths. Okay, a lot of myths, and I couldn't put all of them together to capture them on this video. I selected some few which are very common, and I believe they are very necessary for our life as health professionals, and is also a very important aspect for our listeners, especially those who have been suffering from diabetes, to know more about their condition. Please don't forget to subscribe and then click the notification button. We'll bring you more videos on these topics, and you'll learn a lot. So let's start with the first myth that we'll be learning about diabetes. So it is well noted that some people believe that diabetes is caused by eating too much sweets. Okay, so how does this play out? Is it really true? Well, the facts says that it's not necessarily true. Okay. However, when you eat too much sweets, okay, or foods that contains a lot of fats, what happens is your body builds up and you end up becoming obese. And obesity, is a no risk factor, as we discussed earlier on. Obesity is a risk factor for diabetes. So once you are eating foods that are likely to make you obese, then you are at risk of getting diabetes. However, eating too much sweets doesn't necessarily mean that you get diabetes. Okay. So the second myth we are going to talk about, I find it very interesting. Some people think that diabetes can be cured. Okay. Some people think that diabetes can be cured. Now, I agree to them to some extent, but for the large majority, diabetes is not curable. Unfortunately, diabetes is not curable. So what happens is that when somebody's blood glucose goes so high and the person tests and the random blood sugar is so high, or even the fasting blood sugar is so high, and an impression of diabetes is made. Okay, now we can't say the person is diabetic yet based on just an episode of high blood glucose. So we have to continue follow up to make sure that it is prolonged. That's the word, prolonged. Now, if a person tests and has a very high blood glucose, and the factor or the cause, what is making the person have the high blood glucose is reversible. So if that is reversible and the cause is found and treated, then the person's blood glucose comes back to normal. Remember, this wasn't something that was confirmed. Okay, that's why I said an impression of diabetes is made. So when somebody has high blood glucose and you make an impression of diabetes, it is very important to follow up and monitor the person's glucose. to be sure that it is really diabetes. If it is not, it may be triggered by a reversible cause. And when that cause is treated, then the person's blood glucose returns to normal. Okay, this is very important. Okay, so the next myth we are going to talk about is that patients on insulin, people think that patients on insulin have more serious than diabetes than those who are on the oral medication. This is not true. This is not true. Okay, diabetes, I'm explaining it from the beginning. There are types of diabetes. So once you have different types of diabetes, remember that you are going to benefit differently from different therapies. So the fact that somebody is taking an injection for his or her diabetes doesn't mean that you, the one having taken the oral medication, his own is more serious than yours. No, it is not true. Okay, so let's take notes and be careful about this. So the next thing is, some people also believe that once you are diagnosed of diabetes, it is a matter of time. Amputation is inevitable. This is not also true. This is not true. So what happens is, once you comply with your medications as a diabetic, you are less likely to develop complications, which will result in the amputation. Remember, I said comply. You have to comply with your medications. Okay? And then the other key word to pay attention is to may. You may not develop the complications. Some people still develop some complications despite being on medication. And that is because their glucose is not well controlled on those medications. So your glucose, the fact that you are on the medication doesn't necessarily mean that your glucose is well controlled. Apart from being on the medication, you have to make sure that your glucose is well controlled in order to avoid the complications of diabetes. Okay. So the next thing is that people with diabetes should avoid carbohydrates. That's the next myth people think. So when you have diabetes, you should avoid carbohydrates into that. This is not true. They also need carbohydrates. All you need is to make sure you are taking your medication, and so when you take the carbohydrates, the body is able to utilize it. Okay. So when you take carbohydrate, it is broken down into glucose. And the problem with diabetics is that when it is broken down into glucose, the body is not able to take it up. And when I say the body, I'm referring to the cells. There is a certain hormone that helps the cells to pick it up, and that hormone is called insulin. So that's mostly what the diabetics have problem with. The glucose is in the blood, but the cells are not making good use of it. Okay, and when the glucose persistently stay in the blood for too long, it accumulates, get to a very high amount, and start damaging the blood vessels. Okay, and start damaging cells. Okay, especially the blood cells. So that's where you see the person has a peripheral vascular disease, and the person will end up having wet gangrene, and that will result in amputation of a kind. Okay, the person may develop a heart disease, heart attack, okay, myocardial infarction. These are the complications of diabetes. It's as a result of elevated blood glucose in the individual. Okay, so the last myth I'm going to leave you with, okay, is diabetics cannot take snacks. I mean, this can be true. This can be true. Diabetics, in fact, they can take snacks, especially when they have gone a while and they think they are running hypoglycemic. Then they can take it. It's fine. It helps them to, in fact, keep a good glucose level. Okay, diabetics have high chance of becoming hypoglycemic, especially when they don't take food for a while and they are on medication. They can easily become hypoglycemic. So it is even advisable that they keep snacks with them. Okay, when they start feeling dizzy, they start having this blurred vision, and they start sweating, that means that you are beginning to have hypoglycemia. So you quickly take your snack and you are good to go. So this brings us to the end of this episode of Time with the Medics. I'm sure you enjoyed yourself. I'm sure you enjoyed the myths that we discovered, and you are going to make good use of it. In our next episode, we'll be talking about headaches. Okay, a lot of the my viewers have made requests to make videos on a video on headache. What are the causes of headache? A lot of people have headaches, and most of the time they just uh, zero it down to migraine. Everybody has a headache for 1 or 2 days. They say, "Oh, I have headache. I have migraine." Okay, so our next episode we'll be making video on headache and what are the types of headache, or what can cause it. How do we manage it when we do have it? I hope you enjoy this. So please don't forget to subscribe and then stay tuned. Click on the notification button and don't forget to leave your feedback. I'm making these videos based on your feedback. So please leave your feedback and I'll appreciate it so much. Thank you very much. See you in the next video. Bye.